Welcome from Caregiver Cloud to our course on hand washing. Hand washing is the easiest and most cost-effective way to prevent the spread of disease and infection. When hand washing is done correctly by healthcare professionals, patients are protected from unnecessary illness and complications. Proper hand washing is an international health practice. For healthcare candidates, demonstrating the hand washing technique is essential to passing certification examinations. So let's go over hand washing. The single most important way to prevent patients from getting an infection is proper hand washing. Hands collect germs from everything they touch: patients, surfaces, and objects including phones, keyboards, and touch screens. In order to limit the transfer of pathogens to others, proper hand washing is essential by professional healthcare workers. A healthcare worker should always wash hands before eating or preparing food, as well as before providing any care for a patient. Hands must always be washed after caring for a patient, after removing gloves, using the toilet, changing a diaper, blowing your nose, coughing, or sneezing into your hands. Always wash after handling or touching items that could be contaminated, handling or preparing food, shaking hands, or touching an animal, animal toys, or waste. Let's discuss how not washing your hands properly can spread germs and diseases. A disease that is easily spread by unwashed hands is MRSA. Proper hand washing has been scientifically proven to prevent the spread of communicable diseases. Pathogens from unwashed hands are transferred to food, objects, and surfaces such as tables, counters, railings, and door handles. When someone else touches contaminated items, the germs are passed along. Some diseases that are easily spread include hepatitis A, MRSA, which is methicillin-resistant Staphylococcus aureus, salmonella, noroviruses, gastrointestinal illness, warts, influenza, and colds. Proper hand washing protects both the patients and the healthcare workers. Healthcare professionals should always use proper hand washing techniques because it can prevent self-infection. Besides preventing the spread of infection and disease among patients, good hand hygiene keeps healthcare professionals healthy. People tend to touch their face, eyes, nose, and mouth without realizing it. This can cause self-infection if there are pathogens on their hands. Because healthcare settings are a natural source of germs, all providers should be extremely careful to follow proper hand washing guidelines. Now let's review the hand washing technique basics. This is a demo of washing your hands. First, roll your sleeves up. Then turn the water on and wet your hands thoroughly. Next, put soap on your hands. Now wash your hands, making sure that you get your fingers and under your fingernails. Now rinse your hands thoroughly with water. Keep your hands below the wrists when rinsing. Get a paper towel and make sure that your hands are completely dry. Then turn off the water using the paper towel. When washing your hands, the correct time to apply soap is after wetting your hands. It helps to lift germs, dirt, and oils from the skin. Studies also show that people wash their hands longer when using soap, which removes even more pathogens. If you are using bar soap, rinse it off before and after using it. Temperature of the running water does not affect the process. After applying soap, you should wash all parts of your hands, including under the nails. Rubbing hands together with soapy lather causes friction, which removes pathogens, dirt, and grease from the skin. Germs can be present anywhere on the hands, so all surfaces should be scrubbed, including between the fingers and under the nails. Wash at least 1 inch above the wrists after removing your watch or pushing it up on your forearm. Germs are often found in the greatest number under the fingernails and the crevices around each fingernail. It is important to pay special attention to the fingernail areas. Use a nail brush to scrub under each fingernail and around the edges of each fingernail. The minimum time to properly wash your hands is 20 seconds. The Centers for Disease Control and Prevention, also called the CDC, states that a minimum of 20 seconds of proper hand washing is necessary to remove pathogens and soil from the hands. How long hand washing should last depends on the setting and the amount of exposure to germs. For example, operating room staff and surgeons scrub their hands longer than a nursing aide or home health aide who take a blood pressure reading of a patient. To help remind you of how long 20 seconds is, the CDC suggests humming the Happy Birthday song twice while scrubbing your hands under running water. The best way to rinse your hands is to keep your hands down below your wrists so the water runs down and drips off your hands. After scrubbing your hands, germs and soil can be easily rinsed off under clear running water. Rinsing also removes all of the soap, which can irritate the skin if not rinsed off properly. Always avoid touching the sink once your hands are washed to prevent recontamination. It's important to dry your hands thoroughly after rinsing because wet hands are more likely to spread germs. The Centers for Disease Control and Prevention states that wet hands transfer all types of pathogens much more readily than dry hands or even no hand washing at all. The amount of moisture that is left on wet hands determines how many germs and viruses will remain on the hands. Careful hand drying is a critical factor for preventing contamination of skin, food, and environmental surfaces if you leave your hands wet. When drying your hands with paper towels, use one towel to remove the water and a second towel to completely dry the hands. For an air dryer, rub hands together while rotating them under the air for 30 to 45 seconds. When turning off the faucet, you should use a paper towel. After drying your hands, use a paper towel to turn off the faucet unless the sink has a foot control. You can also use your elbow to turn off the faucet. Remember that you and others first touch the faucet with dirty hands and the germs are still present on the faucet. And finally, if you have to open a door to leave the room, use a paper towel when touching the door handle. This concludes the Caregiver Cloud course on hand washing. Copyright 2016, all rights reserved, Caregiver Cloud, LLC.